Hi, this is Heather Chumley. I'm a Charleston Therapeutic Yoga in Charleston, South Carolina. I am a physical therapist and yoga therapist, and we are going to talk today about stroke rehabilitation and using mountain pose or samastitihi, equal and even standing, and assisting patients to begin to weight bear on their affected side or their hemiparesis side. So the first goal, of course, is to get the patient to the standing position. So if a patient is not standing, this is not applicable to them. We are working with patients here who are standing and ready to progress to gait, pre-gait activities. So the first thing we want to do is have them stand in samastitihi, which is the pose of perfect posture. So beginning to roll shoulders back and down and try to find as relaxed a standing position as possible. Now standing is difficult for this population, so being relaxed in this pose, in this posture is going to be very difficult. So just to begin by standing and begin with breath. So letting the breath calm them into the position with a little more ease. So taking nice long inhalations and even longer exhalations. And depending on the patient's endurance, we may want to start with breath in the chair so that they don't fatigue too quickly with standing. So we're going to have a wide base of support here so that they feel comfortable. And we're going to start just by explaining how we should feel the ground underneath of our feet. So beginning to interact with the sensation and proprioceptive inputs. So just explaining that they need to maybe lean forward a little bit and feel their toes on the ground. Lean back and feel their heels press into the ground. And then leaning left and right, feeling the outer edges of their feet as they press into the ground. Now, as physical therapists and yoga therapists, we often have our hands on the patients or use gait belts to assist them with this. So I may put my hands on their waist and assist them with the weight shift over onto their affected side. So for this example, let's pretend my left side is affected. As I shift them over onto the left, I'm going to give them a little pressure in that left hip so they can feel the grounding. Feel their foot pressing into the floor a little bit. And then shift over to their non-affected side. And just ask them, so what is the difference? How does that feel? Can you make your left side feel like your right side? Can you shift enough weight over onto that left side so that maybe your right heel comes up? And then come back to equal and even standing. How does that feel? Are you putting as much weight into your left foot as you are your right? And if not, can you correct that? And so this right here may be a half an hour treatment, just learning to weight shift. And so the progression here, of course, is weight shifting enough to lift your heel. Can you weight shift? Can you shift over onto that left hip, that left knee, the left ankle enough to lift your right leg? And then come back. So this is a pre-gait activity. We need to lift that leg, support with the left leg to take a step. So beginning to shift weight and then coming back to samastitihi. Shift again, belly in, shoulders relaxed. Come back to samastitihi, mountain pose. Good, inhaling and exhaling. And then maybe shifting weight enough to take a small step forward. Shifting weight enough to take a small step back. Excellent. And then for another pre-gait activity, I like to use the block. And we start in mountain pose as just described. You can have your hands on the patient's gait belt on their hips to help with the weight shift. Or just to help with stability. They're going to shift weight into their non-affected side. And then begin to use that hip flexor, which is often an issue, to step up. And then shifting weight into that leg, pre-gate, so preparing to take a step with the right. And then shifting back, samstitihi, coming right back into balance, preventing falls, creating stability in static stance. Good, step forward, keep breathing slowly and evenly. Step back, mountain pose, find your balance. Step forward, shift your weight, press into that left foot. Step back, mountain pose, even balance. So just some great techniques using yoga, breathing, relaxation to begin to work on gait with your stroke patients who have hemiparesis on one side or the other. Namaste.